All right, so I'm pleased to be joined by Compassion and Choices President and CEO, my friend, Kim Callinan. Kim, how are you?
I'm doing great. Thanks, Dr. Jeff. It's always a pleasure to be with you.
And I know you are so excited about this fourth annual signature event, right?
I really am. It's nice to have a signature event and be in person with you. That's a big difference.
Thank you, thank you. What are some of the things, very quickly, that we can look forward to with this fourth signature event before we jump into our interview?
So this signature event is all about the everyday heroes of the movement. So I think what you can most look forward to is getting to experience what I get to each and every day, which is meeting the people that make our progress possible. And they're just a small demonstration of the kind of people that comprise this movement, and I'm excited for you to get a chance to meet them.
That's wonderful. It reminds me of the Sly and the Family Stone song. We are everyday people, and it sounds like the message is everyday people make a difference in compassion and choices. They are the everyday heroes, aren't they?
That is absolutely right. And for all of you who are watching, that means that you too are the heroes of the movement. When I first arrived in this organization, medical aid in dying was considered a fringe issue by most people. Yeah. Almost nobody wanted to talk about death. And you look now, and we are an entirely different movement. We are the start of a movement that reflects the makeup of the country that we live in. Part of our mission is to help people embrace life and accept the inevitability of death. And when you embrace life and accept the inevitability of death, you're really able to live life to the fullest. And that message is starting to get out. So we're like an entirely different movement that's come about because of the everyday heroes.
And it sounds so holistic, everything you're doing. And in some ways, that speaks to the strategic plan that you have put together along with Compassion and Choices, and listening to the various voices that are part of the organization, whether, being an employee or being a volunteer, being a voice, being a storyteller. Let's talk about this strategic plan.
It really is an evolution of an organization embracing the full aspect of its mission. So our mission has always been to improve care, expand options, and empower everybody to chart their own end-of-life journey. It represents what we've heard back from people they're most interested in while looking at the political realities of the country that we live in.
Let's talk about each of the pieces of this strategic plan. Expanding options. What does that mean?
It's about helping to ensure that medical aid in dying is realized in every state, because with medical aid in dying, it is the single biggest determinant that sends a message that patients have a voice and a choice in the kind of care that they receive.
Right.
And so what we're seeking is to make sure that every state has medical aid in dying, that it's accessible once it's been implemented. And one of the signatures in this year's strategic plan is the removal of residency requirements, so that for those states where medical aid in dying is not authorized right now, we're geographically trying to make sure that everybody is able to get to an authorized state within a reasonable amount of time.
Protecting and defending existing laws and rights. So tell us, how is that particular work being done?
Of course, protecting medical aid in dying is critical, but far more is under attack than just that. It's about whether advance directives can be enforced. It's about whether or not the definition of brain death is going to be maintained. It's about making sure that all of those legal rights, like the Patient Self-Determination Act, remains protected. So we're working each and every day, tracking what's happened at the state and the federal level and through regulations to ensure that our existing legal rights remain intact.
And that's part of a democracy, isn't it? Making sure that our rights are protected. So that's really great. Tell us about improving care. How do you plan on operationalizing that?
We identified 3 priority areas. First, we want to tackle the urgent crisis around dementia by ensuring that we're normalizing advanced care planning for people with dementia. The second area is that we want to address the inequities that exist in end-of-life care, so that no matter where you live, no matter what your race is, no matter what your gender is, you're able to get the full spectrum of end-of-life care options. Everything from hospice care to palliative care to medical aid in dying. And then the final one, which is promoting and enhancing the integration of palliative care into the emergency room.
So
So
important.
that when someone goes into the emergency room, of course they're saved, but then they also have somebody who's talking with them and making sure that their values and priorities match the kind of care that they would want.
And that naturally leads into empowering everyone, right? And so this is something that I think is so important because it does address a lot of the healthcare disparities, all sorts of different disparities, but really talking to everyone as to what it is that they can do, what their rights are, the information they should have. And I've been involved in some of that. Tell us about that, empowering everyone.
So it's actually surprisingly difficult to die in our country, and I don't think most people realize that. Many people don't even have an advance directive, but the reality is that an advance directive simply is not enough. It really takes an informed, empowered consumer or a really informed, empowered healthcare proxy to be able to help ensure that a person gets the kind of end that they want. While our focus and our intention is to create a system that supports everybody, right now our system does not support everybody getting what they want, and we need to give people the information and the tools they need to get the kind of end-of-life experience they want. And we want to be sure we give people those tools and information in a way that is culturally relevant to them.
Any last words for our wonderful audience and participants who are part of this incredible signature event? 4th year, by the way.
So, it's really interesting. This signature event was all about us recognizing and appreciating the everyday individuals who make this work and this movement and our progress possible. But then I immediately got worried because I thought about the fact that there are so many heroes in this movement, and there would absolutely be no possibility that we would be able to recognize everybody who's made a contribution. Ultimately, what we decided was what was important was that people in this movement got a sense to see the kind of people that are comprised of this movement, the many different ways individuals are contributing, from being a storyteller to a donor, to leaving us a legacy gift, to volunteering, and that they would be able to see themselves in the people whose stories they were sharing, and hopefully feel the tremendous amount of gratitude that I and the board and the staff and others within this movement feel for their participation. So if I had one message, it's that everybody who participates is a hero of this movement, and today we're simply featuring a couple of the heroes to give you a sense of the incredible people that are out there.